It's March 15th, 2021, and this is your weekly dose, where we chronicle the country's trek from pandemic back to normal. Whatever normal is, getting there starts with vaccinations. The country has now administered over 100 million doses of vaccine. The number of fully vaccinated Americans is now up to 35 million people. With Johnson & Johnson's one-dose vaccine now coming online, that number could increase even faster. But only 10.5% of the population is fully vaccinated. Experts say that number needs to hit 70 to 80% to reach herd immunity, the point where enough people are vaccinated that COVID cannot effectively spread. So how fast can we get there? Well, keeping in mind that the CDC data is about a week behind, the country is currently averaging over 2 million vaccinations a day, up over 200,000 from last week. At this rate, the country would achieve herd immunity by October 12, 2021. Keeping up that pace, at least at this stage, comes down to production. So how does production look? While other vaccines are coming online, the U.S. vaccination backbone remains vaccines from Pfizer and Moderna. The U.S. government has ordered 300 million doses of each, enough to vaccinate the entire country. Both companies have produced over 60 million doses each, and they are racing to meet their commitment of 100 million doses by the end of March. With the jump in manufacturing this month, the companies are expected to meet that goal if they maintain production levels. All 3 million available doses of the Johnson & Johnson vaccine have been distributed, though the company hopes to have more supply in a few weeks. With help from its competitor Merck, they aim to produce 100 million vaccines by the end of June. However, this week, the government announced that it will purchase another 100 million doses, bringing the total to 200 million ordered. The Biden administration said this will allow for flexibility and committed to providing excess doses to other countries. This week, Novavax announced results from international phase 3 trials. The company found its vaccine to be 96% effective against COVID-19, though effectiveness dropped to 50% for the South African variant. Novavax hopes to release U.S. clinical trial results in the spring and seek U.S. approval shortly after. AstraZeneca is similarly hoping to soon release results from its U.S. phase 3 trials. With more vaccines coming online and the country more efficiently administering vaccinations, states are broadening availability. This week, Alaska became the first state to end vaccine rationing, with Utah saying it will do so in early April. President Biden said he will tell states to make vaccines fully available by May 1. It's unclear whether the president can actually order states to do so, but many states should be in that position anyway. So how does this translate into the real world? Well, big news from Pfizer, with analysis of actual data from Israel showing that the company's vaccine was 97% effective against symptomatic COVID-19 and 94% effective against asymptomatic infections, adding confidence that the vaccine can prevent people from unwittingly making others sick. The company also found that unvaccinated people were 44 times more likely to contract COVID-19. In more good news, lab studies indicate that the Pfizer vaccine may neutralize the Brazilian COVID variant, though it was slightly less effective against the South African variant. Looking at US stats, the CDC is reporting 3,701 cases of the UK variant, up 1,029 from last week. Moving to the South African variant, the CDC is reporting 108 cases in the US, up 40 from last week. And finally, looking at the Brazilian variant, the CDC is reporting 17 US cases, up by 4 from last week. Overall, average daily COVID cases went up slightly from last week, but that was due to a single-day spike in cases from Missouri. Besides that outlier, cases continued to steadily decline. So what's next? As noted in the last weekly dose, CDC guidance reportedly directing vaccinated people to only congregate among other vaccinated individuals was pulled back. The CDC released that guidance on Monday. Notably, it was relaxed, slightly but significantly, now saying that vaccinated people could congregate in small settings with unvaccinated people. In other words, grandparents can visit their healthy grandchildren. This may be a concession within the CDC that there is a limit to the restrictions that vaccinated America will accept, and the divide between the vaccinated and unvaccinated will continue to grow. The vaccine passport controversy now seen in heavily vaccinated Israel is appearing in the US. Attendance to Brooklyn Nets and New York Rangers games is now limited to those who can verify that they are vaccinated. With widely available vaccines on the way, we face a shift in the American dialogue over this pandemic. Americans have mostly followed public health expert warnings to maintain social distancing, but will they continue to do so as the country moves closer and closer to herd immunity, especially if cases plummet? vaccinations have been too limited to require wide-scale mandates. But will the government, employers, and public venues shift in that direction as more Americans become vaccinated? So what is next? A whole new set of issues as the American vaccine debate moves from who's next in line to who won't get in line. And that was your weekly dose. Thanks for watching. If you enjoyed this video, please click the like button and subscribe to the channel for more content on getting through this pandemic. Links to the information in this video are below, and if you have any thoughts or questions, please leave them in the comments. And as always, stay safe.